Hey, everybody. Welcome back to another episode of the Daily Noose with Tim Lynch. I'm Tim Lynch. Today, we're going to talk about long COVID. Now, when I first started planning this show, I had a little trouble figuring out how I was going to do it. Most of the time, I like to go in a very sequential pattern, right? A beginning, a middle, and an end, so we're all on the same page. It's easy to follow. But there are so many things I want to talk about, often at the same time, that it was a little rough to draw that together. And then I figured out if I just went right to the end first, problem solved. So, spoiler alert, long COVID does not fucking exist. Sorry, earmuffs. Sorry, Mom. All right, so why are we talking about long COVID? Well, like everything, I saw something on the internet. I saw actually a video of Rashida Tlaib talking about it. This is Rashida Tlaib speaking at a House Oversight Committee investigating Biden's corruption, and she doesn't like the time and energy being spent on that. So without further ado, H, roll the tape.
I want to know about the American Rescue dollars and where that money is being used. Is it being used towards public health? Is it being used towards the crisis that continues to happen in many of our families being impacted by long COVID symptoms? I mean, these are things that we could be doing right now in this chamber. We're not.
Okay, so a crisis. So not just a problem, a crisis. Not that I've ever seen any politician think anything was anything other than a crisis. But anyway, you know me, I don't like to just limit one person's comment. I like to get a couple of things to show there's a consistent pattern. So that was March 20th, right? So 5 days before that, to celebrate Long COVID Awareness Day, Ayanna Pressley, another member of the squad, published a outreach comment. Let's bring up the overlay and I'll read it to you. She said, long COVID remains a national crisis in America that demands a bold federal response that ensures no one is ignored, left out, or left behind in our recovery. On Long COVID Awareness Day, I'm proud to join national and grassroots advocates across the country to demand action from lawmakers to provide our COVID long haulers, there's lots of names for these, with the resources and treatment they need and deserve. Again, Representative Pressley. So if we're going to talk about long COVID, we need to know what long COVID is, because that's often a question. So let's go right to the source, so to speak. Let's go right to the CDC's, the Center for Disease Control and Prevention. Again, another overlay. I'm sorry. If we could put this up, this was last updated March 14th, 2024. So this is very recent. So this is the CDC's definition on their website. Long COVID. Some people who have been infected with the virus that causes COVID-19 can experience long-term effects from their infection, known as long COVID or post-COVID conditions, PCC. Long COVID is broadly defined as signs, symptoms, and conditions that continue or develop after acute COVID-19 infection. This definition of long COVID was developed by the Department of Health and Human Services in collaboration with CDC and other partners. It goes on. People call long COVID by many names, including post-COVID conditions. Remember, I said there's lots of synonyms here. Long-haul COVID, post-acute COVID-19, long-term effects of COVID, and chronic COVID. The term post-acute sequelae of SARS-CoV-2 infection, PASC, is also used to refer to a subset of long COVID. Now, if you go back a little bit, you'll see one of the words in the definition of long COVID was definition, and that was something we could click on the website from the CDC, and that brings us to covid.gov. And they have some more discussion about long COVID. Yes, I know, another overlay. I'm sorry. Read along with us. So long COVID is a patient-created term. These are our experts, right? Our experts tell us this is a patient-created term, broadly defined as signs, symptoms, and conditions that continue or develop after initial SARS-CoV-2 infection. The signs, symptoms, and conditions are present 4 weeks or more after the initial phase of infection and may be multisystemic and may present with a relapsing remitting pattern and progression or worsen over time with a possibility of severe and life-threatening events even months or years after infection. Long COVID is not one condition. It represents many potentially overlapping entities, likely with different biological causes. I thought the cause was COVID. All right. I digest. And different sets of risk factors and outcomes. So don't pause, don't rewind and listen to that again. Don't read it on a pause screen because I'll tell you, you didn't miss anything. If you're confused, it's because they didn't say anything. Basically, long COVID is everything or anything that you want it to be. Because in their definition, they didn't really say anything. So if you scroll further down covid.gov, you'll find a general symptoms list. I'm sorry, let's bring it up. And if you look at the list on their website, it gives you an out. It says, not a comprehensive list, which reminds me a little bit of all the gender discussion, right? So you ever go up to a lefty and ask them, how many genders are there? You know, early on, they might actually give a number like 14 or 15 or whatever they want. They will never give a number now because whatever number they give in a week, a year, 10 years, there's going to be more. And if anyone ever sees that they said a lower number back then, they get canceled. I know they're lefty, but they get canceled. They didn't say the right number. Don't forget, lessons learned from the French Revolution, the guillotine always comes for you. Anyway, so let's go through some of this list. So tiredness or fatigue that interferes with daily life. Some of us just have that because we work hard. Symptoms that get worse after physical or mental effort, known as post-exertional malaise. Just other words that mean nothing. Fever. Fever I'm just going to throw out because fever's a problem, right? You have an infection, you have an inflammation. This isn't part of long COVID. So let's just throw that out. Next section, respiratory and heart symptoms, difficulty breathing or shortness of breath, cough, chest pain, fast beating or pounding heart, also known as heart palpitations. Now, don't get me wrong. You can have complications after COVID, right? You can have a heart attack from the COVID infection, right? One of the problems is that COVID can cause a coagulopathy. Your blood clots more. You can get a heart attack. You can get a stroke. Now, if you have a heart attack during COVID, and from that you have a cardiac arrhythmia, that's not what we're talking about. That's not post-COVID. That is just symptoms after a heart attack. So throw out that stuff and just look at difficulty breathing, chest pain, pounding heart. What does that sound like? It sounds like a panic attack. It sounds like a set of psychiatric symptoms. But let's move to the next section, the neurological symptoms. That's my bread and butter, man. All right, so difficulty thinking or concentrating, sometimes referred to as brain fog. You want to bring up another patient-invented term? Let's go with brain fog. There is no diagnosis or symptom set in neurology known as brain fog. Headache, sleep problems, dizziness when you stand up, aka lightheadedness. Pins and needles feelings, change in smell or taste, depression, or anxiety. Now, change in smell or taste, that's just one of the complications of COVID. Again, that's not what we're talking about. That's just COVID. So throw that out. Put everything else in there. Difficulty thinking or concentrating, sleep problems, those are all symptoms of depression and anxiety, right? So if you went to medical school and you learn all the abbreviations for all the symptoms of depression, sleep is a problem. SIGI caps, right? Sleep, concentration, that's just all psychiatric problems. Dizziness when you stand up, I know what you'll think, well, that could just be something normal. It can be something normal. It can also be a problem. But it's also common in something called postural orthostatic tachycardia syndrome. This sounds like it's a dangerous disease, but it's really an anxiety-based entity. And of course, if you go near the bottom, there's depression or anxiety, which aren't neurological symptoms. They're literally psychiatric symptoms. And of course, I forgot pins and needles feelings. Now, you might say, well, that's neurology, right? That's a problem with a nerve. Yes, if you have a pins and needles sensation in a particular nerve distribution or a nerve root from a pinched nerve or sciatica, peripheral neuropathy, what have you, fine. But that's not what they're talking about. Again, they're talking about my whole body's got pins and needles, and that's not something you see in neurology. That's something you see, again, from a psychiatric cause. Next set, digestive symptoms, diarrhea and stomach pain. Yeah, that's irritable bowel syndrome. That's anxiety. Other symptoms, here's your grab bag. Joint or muscle pain means nothing. Rash, Again, everyone has some legitimate thing that has nothing to do with post-COVID. Rash, you might be allergic to something. Who knows? But that's not part of this. Changes in menstrual cycles, maybe because you took the jab. But anyway, let's move on. So if we scroll further on that website and look at what else covid.gov has to say, they will talk about the symptoms, and they literally say some people with long COVID have symptoms that are not explained by tests or easy to manage. Well, what do you mean not explained by tests? Well, read along. People with long COVID may develop or continue to have symptoms that are hard to explain and manage. Clinical evaluations and results of routine blood tests, chest x-rays, and electrocardiograms may be normal. I'll throw in some other normal ones: MRIs, EMG nerve conduction studies. Do you know why their tests are normal? Because there's nothing going on physically in their body. That's why it's all coming up normal. That's why if you have depression or anxiety or other mood disorders, your physical tests are normal. So let's go on. The symptoms are similar to those reported by people with myalgic encephalomyelitis / chronic fatigue syndrome, or ME/CFS, if you're in the know, and other poorly understood chronic illnesses that may occur after other infections. People with these unexplained symptoms may be misunderstood by their healthcare providers, which can result in a delay in diagnosis and receiving the appropriate care or treatment. So I will tell you, they are not misunderstood by their caregivers. We used to call them doctors back in the day, not healthcare providers. They're well understood. It's just that the people with them don't like the answer. They want a physical diagnosis and not a mental diagnosis, which, by the way, is still real. Right? You just have to delineate it. All right. So what do they mean? What are these other poorly understood chronic illnesses? I will tell you. And you've probably heard of some of them. So fibromyalgia, POTS, which again we just mentioned, right? Chronic fatigue syndrome back in the day. Now it's ME/CFS. And by the way, let's look at that. What is ME/CFS? So chronic fatigue syndrome, I'm tired. Great. That's just literally number one with a bullet on the chart of depressive symptoms. What is myalgic encephalomyelitis? Well, it's a big term. If you break it down by Latin, myalgia is basically pain with your muscle. Myo is muscle. Encephalo is brain, and myel is spinal cord. So basically they're saying muscle, brain, and spinal cord, and itis means inflammation. Muscle, brain, and spinal cord inflammation. Except there's no evidence of inflammation, directly or indirectly. It just does not exist. One other little known fact, the COVID-19 virus does not actually go into the brain. It is not neurotropic. It's on biopsies, on autopsies, it's not been found in the brain. All right, so let's go on. So chronic fatigue syndrome, ME/CFS, irritable bowel syndrome, interstitial cystitis. And you're like, what's interstitial cystitis? It's basically the fibromyalgia of your bladder. The vapors, right? Well, what are the vapors? The vapors are basically all of these things. All of these things are basically the same thing. There's these vague complaints of fatigue or pain or discomfort that have been around, honestly, probably forever. We know the vapors at least have been described as early as the 1700s. But knowing that human nature doesn't really change, this has probably been around as long as God has created Eve from Adam's rib. This is just the latest iteration, right? All these symptoms existed, but now we have a new entity to kind of hook onto. So long COVID is just the same old thing. It's just the vapors or the chronic fatigue syndrome or whatever generation you're in, but now we're in the COVID generation, and that's what it's getting linked to. Now, again, you're probably like, wow, that all makes sense. That is very reasonable. Thanks. But don't take my common sense for this. There are actually studies documenting this. There's actually a fair number of them. I'm just going to talk about two of them. One was out of France, November 8th, 2021. 2021. So this was well known long before the March 2024 pronouncements and videos we just talked about from the squad. Anyway, association of self-reported COVID-19 infection and SARS-CoV-2 serology test results with persistent physical symptoms among French adults during the COVID-19 pandemic. I really wanted to go in a little depth of this, but I won't. Basically, at 26,000 people with complete data for serological testing, right? So they knew whether they had the infection or not. And briefly, well, I'll just read the conclusions and relevance. The findings of this cross-sectional analysis of a large population-based French cohort study suggest that persistent physical symptoms after COVID-19 infection may be associated more with the belief in having been infected with SARS-CoV-2 than with having laboratory-confirmed COVID-19 infection. So it didn't matter if you actually got infected or not. The symptoms were the same. There's another study from a JAMA publication. This one, I think, was from America about a year later than the French study, but again, about a year and a half still from our discussion. Association of initial SARS-CoV-2 test positivity with patient-reported well-being 3 months after a symptomatic illness. So there was about 1,000 people. They had a symptomatic illness that may or may not have been COVID. When they tested them, about 3/4 of them were positive and 1/4 were negative. And then they went back and looked at a number of different symptoms 3 months later. And those symptoms looked at physical function, anxiety, depression, fatigue, social participation, sleep disturbance, and pain interference. So basically your long COVID list of whatnot. And when they looked at the two groups, there was basically no difference. So long COVID symptoms occur whether you get long COVID or not, because long COVID doesn't fucking exist. Sorry. So all of that was known. That was known to me. This was not new. So now you know when I saw these recent pronouncements, I was just beside myself, right? These people are charlatans. I don't know why they do it. I don't know if they just do it to get their name out there. I don't know if they're doing it for votes. I don't know if they're trying to get money so that they can get more votes. Maybe it's still just more control, right? I mean, there was a ton of control during COVID with their lockdowns, and maybe that's fleeting and they don't want to get rid of that. Maybe it's all of the above. I don't know. But at the end of the day, long COVID, LoCo, as I like to call it, is nothing new. It's been the symptoms have been around, again, probably since the dawn of man. It's not linked to COVID. It's just the vapors. And we have the common sense. We have the statistical proof to back it up. And if you still don't believe me, I've got one more overlay. Again, from the CDC, what you need to know. Long COVID is a real illness and can result in chronic conditions that require comprehensive care. All right. You know what no one ever said to us in medical school? This one's a real illness. So if they have to tell you it's a real illness, it's not a real illness. Okay. I think we're done. I think I've made my point. Thanks for watching. Thanks for being here. I really appreciate it. It's really cool having you guys here. So stay safe, stay armed, keep your feet on the ground, and I'll see you next time. So, is anybody else's vision changing? Anybody getting a little tingling, funny? No? Just fuck. Okay. That's a wrap.